Hello, and welcome to the Cass Health Podcast, the show where we hope to connect our community with healthcare information that's relatable, understandable, and useful to your life, and where you get to know better the neighbors providing your care here. I'm your host, Carter Anderson, and in today's episode, we'll be learning about strokes with emergency physician, Dr. Heather Hergott. Before we get started, 2 quick disclaimers. First, the comments in this podcast do not necessarily reflect the views of Cass Health. Second, the information in this podcast is not intended to be construed as personal medical advice. Always consult your primary care provider with your questions and concerns regarding your health. Heather, thank you so much for taking some time to chat with us today.
Good morning.
Yeah, good morning. So today we're going to talk about strokes, kind of get into that. That's our main topic for today. But before we get into that, we'd like to spend a little time kind of getting to know you a little bit, let the audience kind of get to know you as well. So
Okay.
We'll start with, where are you from?
I'm originally from Fairbury, Nebraska, so it's a small town in the southeast corner of the state. Went to undergrad in Lincoln at Nebraska Wesleyan, and then moved to Kansas City for medical school, did my residency in New York, and now I live in Elkhorn, Nebraska.
Oh, very cool. That's awesome. Where in New York did you do your residency at?
In Southampton.
Southampton.
So the east end of Long Island. So when people say they summer in the Hamptons, that's where I was. It's not near as glamorous as what we see, but...
It's not as wonderful as they make it seem on the internet, at least.
Right. Or at least I wasn't invited to those parties.
Funny. Do you have a favorite sports team?
I like the Atlanta Braves. I don't watch sports as much as I used to, but when I was younger, that's the team I always watched with my mom, probably because it was one of the few teams we could actually watch regularly because of TBS. They were always on TBS at that time, so that's probably still my team. I'll still cheer for them. I'm not frequenting games and not up to date on all the stats and players, but that's probably still my team.
Yeah, that's cool. That's a crazy story that I'm like, why are there so many Atlanta Braves fans? It's like, well, a while ago, that was the only team you could watch on TBS was the Braves because they had that contract. So that's funny that still so many people are a fan of that franchise. Our next question is, favorite thing about Disney? Are you a Disney fan?
Oh, yes, I'm a Disney fan. I got married at Disney World because I like the fireworks so much. So my favorite part of Disney is going to Disney World and watching the fireworks. So it's kind of always been a fan, always have watched Disney movies. And then when I finally was able to go to Disney World at, the age of, 20, it was pretty great.
That's awesome.
And my favorite Mickey is the Sorcerer Mickey, where he wears the hat. The one in Fantasmic. Awesome. That's my favorite Mickey.
That's your favorite one. Your hierarchy of Mickeys, that's number one.
Yeah.
There you go. How many times have you been to Disney?
I'm not sure.
Not sure?
We'll just say 10, but It's probably more. But
I love it. Between 10 and a dozen, somewhere in there.
Yeah.
There you go. That's awesome. If you're cooking, dinner to impress, what are you making?
One of my friends, she'd given me this recipe where you marinate steak in wine and just kind of let it marinate for a while, and then you just cook it in the frying pan. So that's kind of what my go-to is to make a wine steak. I make Gouda bacon mashed cauliflower with it. And you wouldn't think it's mashed cauliflower. It tastes amazing. And Brussels sprouts, that's kind of my go-to meal. That was the first meal I made for my husband before he was my husband when we were dating. But I cooked that, and he didn't want to eat Brussels sprouts. He didn't want the mashed cauliflower. He was super upset about it. And now it's his favorite thing. So if there's a time and I'm off, he's like, oh, you should cook this weekend. You should make steak, your wine steak. So that's kind of my go-to.
So did you convince him to try the Brussels sprouts
Yes.
and mashed? I didn't know if you were like, go ahead and try it.
No, he ate them and he loves it. He requests to eat it. If we go out to dinner now, he'll eat Brussels sprouts. And it was something he had never had before, but because I guess mine were so good.
Do you like roast them, or how do you make the Brussels sprouts?
Yeah, I roast them.
Okay.
Mm-hmm.
That's what I was going to say. That's the best way to have Brussels sprouts, in my opinion, too, is that way. So
yeah.
If you're driving alone in the car, what are you jamming out to?
Taylor Swift. Always Taylor Swift. I haven't stopped listening to Taylor Swift for like a couple years now. So my husband is quite annoyed when he's in the car with me. He's requests anything else. And I'm like, but it could still just be Taylor Swift. So
it is always Taylor Swift. Do you have a favorite album?
I really like her new album, The Tortured Poets Department. I really like it.
Very nice. Awesome. Have you seen her in concert at all?
Yes. Over the summer, I went with 2 of my closest friends, and we went and saw her in Paris. It was cheaper to go there than to see her anywhere else. I know people were saying that before, but it really was. And it was for his 40th birthday, so it was a lot of fun.
Oh my gosh, that's so awesome. Well, we'll go to Paris, I guess, to see Taylor Swift. That's a fun trip. Wow. Favorite holiday?
Christmas. I love Christmas. I love it more when there's snow, so if we could go back to having white Christmases here in the Midwest, that'd be great.
I know what happened. It seemed like they got all the snow south of us this time, so hopefully we can get a white Christmas next year. Do you have a favorite fun fact about yourself or favorite thing that you, like if when you're going around doing those icebreakers, is there something that you always like to share about yourself that you want people to know?
Yeah, I guess it's the getting married at Disney World. That was always something I dreamed of, and I worked really hard to save up for it, and it just kind of happened. So it was pretty magical. I mean, I love the fireworks. That was kind of a big push, and then Mickey and Minnie came to the reception, so it was pretty great. So I have pictures dancing with Mickey Mouse at my reception, so it was pretty great.
Oh my gosh, that is so sweet. Like you said, kind of a dream fulfilled, right? To get to do that. That's awesome.
Yeah.
Favorite book or movie?
My favorite book used to be, or books, The Lord of the Rings, when I was younger, because I read that when I was in undergrad and college. And now I just recently got into reading again. Seems like my nurses were always talking about different books they were reading, and I'm like, well, I want to get on board with this. So I've initially got a couple books from Katie Christensen. She's like, read these, you'll like them. And so then I started to like reading, and now it's pretty much anything that's romance, happily ever after, that's what I'm reading. So
that kind of genre. There
yes.
You go.
Yeah.
Very nice. Do you have any hobbies?
And right now it's just reading. We recently built a new house and moved, and so with that recent move, it seems like all my time has been kind of still getting settled in the house. There's still little things that we're fixing up on the punch list, so it's kind of all consuming with my time.
Right.
So I'm either that, sleeping, or reading, it seems like.
My hobby is my new house and reading. There
yes.
You go. Very nice. Next or dream travel destination?
We're planning, hoping, for my husband's 40th birthday, we want to go on a Christmas market river cruise. They do them in Europe. I guess the German Christmas markets are supposed to be the best thing to see over the holidays. So that's kind of something I've wanted to do, talked about it with him. He's also interested in it. So yes, I know he's only 40, but we live old people lives. So
that sounds like a retirement activity
yes.
for some people. That sounds like a fun 40th celebration too. So yeah. Awesome. We always like to hear from our physicians, why medicine? Was there a specific moment or period in your life when you're like, man, I really want to get into medicine? And then why emergency medicine specifically too?
So I've always liked my science classes more than any other classes. When, you finally get to dissect a frog in, junior high or whenever that was, it's always, so entertaining. And that was kind of always my big push towards medicine versus anything else, was that I liked all the science courses. And then I know when I was young, my father passed away when I was 9. We didn't really know why. And then when the doctors couldn't give you a specific answer right away, that always also has put more intrigue into my kind of brain. It's like, why I feel like I should know. I just want to have answers and know. So if I, do all this training, then I'll always just know, even though you don't always just know. Right. So don't think that doctors have all the answers, because they truly don't. But so that was kind of, I think, what helped me go towards medicine. I know when I first started college, I thought maybe psychology, because obviously humans and the brain, that's always really interesting. But then kind of went back more to the medicine side of it, and then went through rotations in med school, and then emergency medicine just seemed to be the one that would stick, because I always see different people. It's not the same patients every day, not the same disease process, so it's always something a little bit different. So I really like that aspect of emergency medicine. So, you get your true emergencies where everybody's working fast right away, trying to save somebody, and there's a lot of reward in that. And then sometimes it's something as simple as, you came in, I'm going to put in a couple stitches. So it's just rewarding to do different things and see those changes.
Cool. It's kind of the variety in your day when you get to work in emergency medicine. Cool. Can I have you tell us a little more about your education and training, and kind of a quick overview of your kind of career path to where you are now working in the Cass Health ER department?
Yeah. So like I mentioned before, I went to undergrad at Nebraska Wesleyan in Lincoln, then med school in Kansas City. I did my clinical years in medical school in Wichita, Kansas, and that was very, very educational. I know when I started my residency, based on what I did during my clinicals, I was leaps and bounds ahead of most other people in my program. So it was lots of really hands-on. I really just pretty much functioned as a resident at that time, so it was pretty great. I really liked being in Wichita, and then went through the whole match process, ended up in Southampton, New York. It was nice. It was kind of a small town feel to it, yet in the summer it'd be quite busy, but went through my residency there. I did a lot of my elective rotations were in trauma or emergency or ortho, just because I always knew I kind of wanted to end up in an emergency department. Then started looking for jobs around graduation time. Something opened up in Council Bluffs, and it was a good fit, so I started working in the emergency department at Methodist. Jenny Edmondson was working there, and through my trauma rotations I had done previously, I knew a nurse practitioner who had worked here at Cass, and she was like, you have to come work PRN here, you have to come. And then I started working PRN here, and which turned into part-time here, which is going to hopefully turn into full-time here. So it's just really great working here. So just kind of been all over, I guess.
Very cool. That's what I wondered out. It's like, okay, Lincoln is not that far away, but still kind of like there's a lot of different places to work between here and there. So
Yeah.
Very cool. Okay, we'll kind of get into our main topic here today, which is strokes. We just kind of want to start out by defining what is a stroke, and are all strokes the same?
A stroke is a medical emergency when you're not getting adequate blood flow to the brain. Typically, there are two types of strokes. We see ischemic strokes the most, and that would be where there's a blockage in a blood vessel, so you're not getting blood. But we also pretty routinely will see hemorrhagic strokes, which can be where a blood vessel bursts or ruptures, and then you have bleeding where there shouldn't be bleeding. So those are the two types. Ischemic, hemorrhagic.
So are those two types treated differently based on what's happening?
Yep, the two types of strokes are treated differently. A lot of times with the hemorrhagic stroke, we see that with really high blood pressures. And so kind of the first step is to start treating the blood pressure with medications for that to get that under control. And then with an ischemic stroke, we treat that depending on onset of time. So that's why we always say it really is a true emergency. If you come to us within the first 4.5 hours of onset of symptoms, we can give you a medication. It's a clot buster medication that helps break up that clot, and so sometimes we can get blood flow back after that medicine, but it's very time sensitive. So
that time is everything, absolutely. What are the symptoms for a stroke?
So the most common that I think everybody knows of, they think of your facial drooping, or all of a sudden, the lips hanging down. People can't talk, whether it's they can't get words out or they're just kind of slurring their speech and you can't understand them. Then obviously, the numbness, the weakness, all of a sudden, you're not able to move your arm. People are going to think, that could definitely be a stroke. But there are other symptoms that people have, a little less common sometimes with different types of stroke because there's multiple different blood vessels in the brain. A posterior stroke, you might be off balance. So if all of a sudden you notice you can't walk, just kind of feel like you have a disequilibrium, unsteady, that can be a symptom of a stroke. Dizziness can also be a symptom of a stroke. So when people say the room's spinning, I can't get it to stop spinning, that can be a stroke. There are other reasons you can have the same symptoms, but obviously what we want to rule out all the time is the stroke and hope that it's one of the not as bad type of reasons to have the dizziness. Sometimes really bad headaches. So when people have the high blood pressure and have the ischemic strokes, it could be because your blood pressure is very, very high and you have a headache from that. So that's why one of the times when people come in and they say, I have a really bad headache and my blood pressure is really high, we're always doing a scan because we want to make sure there's not bleeding or a hemorrhagic stroke from that. And then even something as simple, sometimes with vision changes. And I don't mean just like fuzzy vision or blurry vision. It's more you can't see part of your eyes, or you are always seeing multiple. And there are other reasons you can have those symptoms too, but it can be with a stroke, and so that's kind of why sometimes you might think we're doing a lot of extra things in the emergency department, but we always are just trying to rule out worst case scenario, which is a stroke.
Right. So what does someone do if they're experiencing any of those symptoms? Do you call 911? Do you just head right to the emergency department? Do you call your doctor? What should somebody do if they're experiencing some of those symptoms that could be related to a stroke?
Like I said, definitely it's an emergency, so calling 911 is something we'd always recommend because they are also then calling us, giving us an update. They're doing an initial assessment. And a lot of times people might think, oh, well, I can get there faster if I just drive. But if you come by 911, they can get an IV started for us. They can get blood sugar. There are multiple other components that we need to start doing our job right away. So coming by 911 is always the best because that we really got to get everything done in 4.5 hours if we can get you that medicine that we need to get you.
Absolutely. So you kind of mentioned some symptoms also that might be, like you said, related to something else. What if someone isn't sure that it's a stroke? Should they still come into the emergency department regardless and kind of get that medical attention as soon as possible?
It's always best to come in because I'd much rather have you come in and me tell you there's absolutely nothing wrong with you than you stay at home and we miss something. So if you're like, I don't know, my arm sometimes feels numb in the morning, maybe it's the way I slept, but today it really doesn't feel right and I can't move it, instead of just thinking it's something else, it's always best to come in and let us check you out.
Rule out the worst, absolutely. I've heard of mini strokes. What is a mini stroke? And is that as serious as like a regular stroke, I guess I'll say?
Yeah. So a lot of times when people say mini stroke, it's what we would call a transient ischemic attack or a TIA. So a mini stroke is typically when somebody comes in, you have stroke-like symptoms and they get better. So maybe you woke up and you couldn't use your right arm and you're on your way to the hospital, and by the time you get to the hospital, now you're able to move that arm. And so that's something that we believe that you had that episode where you could not use that part of your body. And so that's what we consider that a mini stroke or a TIA. And they still are an emergency because within the 24 hours of onset of those symptoms, they're more likely to return. So if you come in and we do a workup and everything looks normal, we're still pretty likely going to want to keep you in the hospital and watch you, because those first 24 hours can definitely be consistent with you developing a stroke. So they are always an emergency as well. It's always something we want to check out. But yeah, when we say mini stroke, it's just that you had symptoms, they got better. So it's a TIA, but still definitely something that we take pretty serious.
So that mini stroke or a TIA within that 24-hour period could lead to like a full-on stroke?
Yeah.
Okay.
Yeah. And I know we're starting to have, advancements in medicine. We do more imaging studies than we used to, so we can rule out more than we used to. So we're almost to a point where we don't have to keep everybody and watch them, because we'll just do multiple different types of scans with contrast, and then we can really rule everything out. But it's kind of that initial, you come in with some vague symptoms, but if they come back, they could be persistent. It could be a stroke.
Gotcha. Are there pre-existing conditions or certain things that make people a higher risk to have a stroke?
Yeah, definitely age, so 55 and over, and then every 10 years after that, your risk of having a stroke increase. High blood pressure, high cholesterol, diabetes, if you're a smoker, that all contributes. We see it more common in women than men, especially some of the patients will come in who are younger that have strokes. They're more likely to be women. We can see that because of birth control, different clotting disorders, and so that can contribute. Also atrial fibrillation. I know people a lot of times get that diagnosis, especially as they get older, and they're always on blood thinners. They're on blood thinners because that arrhythmia that you have can cause you to get clots and have a stroke. So we always pretty proactive with multiple diagnoses. And then, like I said, just lifestyle, so smoking, drinking, kind of those factors. If you're overweight, obese, that can also contribute to someone having a stroke.
Gotcha. Kind of heightens the risk of a stroke occurring. Mm-hmm. Gotcha. So if someone has come in and you're highly suspicious that it is a stroke that they're suffering from, what happens next?
It's going to be a lot of people, a lot of things going on really fast. So we kind of activate a stroke alert. So one of the first things we're going to get a set of vitals. We need a blood sugar. We need an IV, and then we need to get you to CAT scan, because like I said at the beginning, there are two types of strokes, ischemic, hemorrhagic. If it is a hemorrhagic stroke, you would not be a candidate for the clotbuster medicine, because obviously there's already bleeding. But if it's an ischemic stroke, so we get that scan done and we see there's no bleeding, then we need to get that medicine on board. And like I said before, we kind of have 4.5 hours from onset of symptoms to get that medicine. So it's always a pretty big rush right when people get there. You have to have a solid team, and we all work together. We know what we're doing. It's not just me. It's not just my nurses. We've got techs and radiology technicians and multiple different people helping out to get things done as quick as possible so we can get you the treatment you need.
A wonderful team that helps take care of everybody as fast as they can.
Yes.
So after that kind of immediate medical emergency is over, kind of that, like you said, that 4.5 hour window, what is treatment and recovery like for someone that's suffering or suffered a stroke?
A lot of times you'll be on an antiplatelet medication for years, maybe for life. So that's when sometimes people are on aspirin, sometimes they're on Plavix, and it's really kind of up to your doctor, the neurologist, what they recommend. It used to be everybody was on Plavix, and some doctors only went aspirin, so it kind of goes back and forth. But typically one of those medications for long term. And then rehab is one of the most important parts of treatment following a stroke, because it's not just physical therapy. So you have a stroke and you can't use your right hand very well, you don't have a lot of grip. We want physical therapy involved, but also we're going to get occupational therapy involved, speech therapy. So there's multiple different therapists that are involved to kind of help with that after, because some people get the clotbuster medicine and get better. Sometimes they get it and they don't get a lot better. So it's a lot of rehab afterwards. And so the different therapists are always going to be somebody that you'll see while you're in the hospital, but then you'll also be following up with them typically after.
Well, those therapists and stuff like that, you mentioned like occupational and rehab and stuff like that. Will anyone ever go to like cardiac rehab or some other department like that after suffering a stroke? That's just a question I was curious about.
Yeah, and they possibly could, especially like I said before, there are different reasons or risk factors that people have strokes. Some people don't know that they have high blood pressure. Sometimes people don't know they have atrial fibrillation. So when we do that workup and we find out that you have a stroke, but we're also going to look at your other organ systems, kind of make sure it's like, oh, well, you had a stroke because you're diabetic. You didn't know you were a diabetic. You didn't know your blood pressure was high. So sometimes there can also be with the stroke, you might need some rehab with your heart too, because sometimes it does have an impact from your heart. I've had patients before that come in and their EKG looks like they're having a heart attack, but then they also look like they're having a stroke, so we scan their head. So sometimes you need a couple different processes worked up, and you're going to need a couple or multiple different areas of therapy after. So
just wherever, that's kind of a case-by-case thing.
Yeah.
Gotcha. Are there things that I can do to reduce my risk for a stroke? Like you kind of mentioned some lifestyle modifications earlier. Could you kind of highlight some of those a little bit for us?
Yeah. I would say one of the main is lifestyle modification. So obviously, if you're a daily smoker, smoking increases your risk, so everybody should stop smoking. If you're a heavy drinker, limiting your alcohol intake. If you're overweight, trying to do some regular exercise. And even if you're not overweight, just regular exercise is just overall, it's good for everyone. Even if it's something as simple as going and walking a mile, walking a couple miles a day. I mean, physical activity is good for every person, overweight or not. But obviously, getting to a healthy weight is something that's beneficial. And like I kind of said before, sometimes people don't know what's going on. They don't know that they have any medical problems. So I would say, routine health maintenance with your primary care provider would be very important, because you might feel fine and actually you have diabetes, or you might feel fine and have high cholesterol, and it's just something you don't know about. But having routine visits with your doctor, or your nurse practitioner, your PA, whomever you're seeing, is going to also really help you understand kind of how your health is going, even though you can think you're perfectly healthy and maybe you're not, but then we can get you on the right path.
Right, and that primary care provider can help also see those little incremental changes that you might think, I feel fine, and they're like, no, actually, from the last time you were here, your levels are high for a certain thing, and they can help you regulate that stuff. Mm-hmm. So, very cool. If someone has suffered a stroke once, are there chances of having a follow-up event increased at all?
Yeah, so if you've had an initial stroke, it's about 23%. 1 in 4 people will have another ischemic stroke. So unfortunately, it is something that we do see a reoccurrence of if you've already had one. But a lot of times, one of the reasons is, if you have underlying medical conditions. So, you have atrial fibrillation and you're off your medication, and then you came in and you had a stroke, and it could have been the same thing again. You're off your anticoagulation medication, and then they can have a recurrent stroke. Or if you've always been a smoker, I know it's easier said than done just to say quit smoking, but again, that's a risk factor. So if you've had one, you still have that underlying disease process, and it makes you more likely to have a repeat event.
So keep taking your medication, everybody. Don't just stop taking it.
Correct.
And try to modify lifestyle stuff as much as you can to reduce the follow-up stroke. Gotcha. Yes. As an emergency physician, you've seen a lot and helped people through some of the worst days of their life. What's it like treating a patient who is suffering from a stroke? Are there moments or patients that have stuck with you from those stroke treatments, kind of that 4-hour window like you talked about, that where it's like, I need my whole team, everybody in the ER, here to help get this person the help that they need?
It's always most rewarding when we can actually make a difference and see an immediate improvement. We don't always see an immediate improvement, but I've had patients before who come in who they cannot talk, they cannot move whichever side of their body, right side, left side, can't move their arm, can't move their leg. And we get everything back. We get all the scans. They're a candidate. We give them the TPA, that clotbuster medication. And then by the time we go in and do a reassessment, now they're talking. And now they're moving their arm, they're moving their leg. And so I don't have a lot of cases like that, but ones I have, it's always most rewarding, because it's like, Grandpa, we fixed you, and you're able to talk to us now. So it's always pretty exciting, and even for family, because they see them when they come in, and the last time they saw them, they couldn't talk to them, they couldn't move, they got brought to us by an ambulance. Then by the time they're back in the room, we get the medicine on board, then they're talking to them, and so family members will be really appreciative too. And so that's always the most rewarding aspect, I think, of my job, is when I get to see, the immediate change and know that they're doing better because of what we did as a team.
Very cool. You literally got to save someone's life together.
Yes.
That is so, so cool. If someone's listened to this podcast and they're like, man, that is a lot of information, if there's one thing that they take away from listening to this, what would it be?
Would always be to come in and get assessed. The main thing I can't drive home enough is that time is what's most important. We have that 4.5-hour window to get you that medication, but also keeping in mind that even if you don't get that medication, there are still therapies that we can give you. So don't just think that she said 4.5 hours, I shouldn't come in. Definitely come in, because there's still things we need to do. So always, I would say, just to drive home the importance of coming in, getting checked out, because I'd much rather say there's nothing wrong with you and let you go home than have you stay at home and miss something. So
right, rule out the worst, and if it is the worst, treat it, and if not, get you the help that you need. So Thank you so much for taking some time and talking with us about this very important topic, and it's great to get this information out to the listeners. So thank you.
Yeah, of course. Thank you.